Today we're talking about a bit of a sensitive topic. We're talking about pregnancy discharge. So the medical term for vaginal discharge is leukorrhea, and in pregnancy it's very common, especially to have an increase in volume. It's one of the most common complaints of pregnancy. It can be uncomfortable, it can feel embarrassing. However, I really want to normalize this. This is very normal and it serves a really helpful purpose in our pregnancy, from protecting from infection for our baby, for our cervix. You can think of it as an extra shower or self-cleaning mechanism for our vagina. In most cases, there is nothing to be concerned about, and it's absolutely nothing to be embarrassed about. I've got a demo for you today of what is normal and what is abnormal, as well as some tips and tricks on how to make it a little bit more comfortable in your pregnancy. Of course, this is general information only. If you're concerned, please ask your own healthcare provider. The vagina is a mucous membrane similar to the mouth, and so there will be liquid secretions. The pregnancy hormones, progesterone, and estrogen that increase in pregnancy also put an increased blood flow to the uterus and to the pelvic area, and this is going to increase the secretions. Also, part of the cervix that is usually on the inside can get pushed down a little bit to the outside, increasing the volume again. Normal color is clear or white. It can be normal to have a slight tinge of yellow, but if it is yellow and you are at risk of STIs, you definitely want to check that out with your doctor. It can also be normal to have a slight tinge of pink, especially in the beginning. It could be some implantation bleeding or towards the end as your body is getting ready for labor. It may also be a little bit brown towards the end, but again, if you're concerned or you have overt bleeding, you'll want to check that out with your physician. It may be a little bit creamy or sticky. Towards the end, it can get thicker and stickier as you get ready for birth, and you may also lose your mucus plug at the end. Not during pregnancy. Between 1 and 4 milliliters is normal. So I've got between 1 and 4 here. I'll show you what that looks like, and it can be much more during pregnancy. 1 milliliter is going to look like this. 4 is going to look like this. And that is normal, not during pregnancy. So if we're going to talk about doubling or tripling that during pregnancy, let's have a look at what that might look on period underwear that prevents leaks. So first I'll show you the one again on the underwear. So just one might look like that. And so I'm going to add 3 to that. And again, this is normal, not even during pregnancy. And let's add another 4 to that because the volume can drastically increase. And so it may look like that. Abnormal discharge in pregnancy would be likely from a yeast infection, or it could be from amniotic fluid leaking. So a yeast infection, you're likely to get the cottage cheese like discharge. It may also be itchy and irritated and sore around the vulva. And if you do have this, go see your healthcare professional. It's really easy to fix during pregnancy. And then for amniotic fluid, this could be leaking from inside. This could be a risk for preterm labor. If it's clear, liquidy, or thin like urine, then you would also want to go get this checked out immediately as well. I'm not going to go into it a lot, but if you are at increased risk of a sexually transmitted infection and you have discharge that is either yellow, green, or gray, then definitely go see your healthcare provider and get it checked out. Some tips and tricks to make it a little bit more comfortable and manageable.
Shower rather than bath. Keep your vulva clean and dry. Use organic and breathable cotton underwear, or try organic unscented cotton panty liners or leak-proof underwear. Avoid tight pants or underwear. Avoid douching vaginal wipes or deodorants. Avoid scented personal care products. Wipe from front to back when using the toilet. Wash your hands before touching your vagina and clean before and after intercourse. Avoid tampons and use sweet almond oil for perineal massage. Try a good quality probiotic. Reduce sugars, sweetened beverages, and refined carbohydrates. Change out of wet clothes and keep your blood sugars well controlled.
I hope this relieved any concerns you have. I know it's a difficult topic to talk about, but I hope it was helpful. If you have any questions, put them in the comments below. If you have any tips for the community, put it in the comments below. Of course, I will keep making pregnancy workouts, yoga, birth education every week. If you like videos like these, please subscribe and hit the notification bell. Thanks so much for joining me. If you like this video, I'm going to link to another video I think you would find helpful as well, and the whole pregnancy workout and yoga playlist. You can save the playlist and come back to the different workouts whenever you like.